Good morning. Today we're here at the World Implant Expo with Dr. Akshay Kumaraswamy, periodontist and implantologist. Good morning, sir.
Good morning.
We're really happy to have you here today.
Thank you. I'm glad to be here.
So we'd love to know more about your personal life and how you got started in dentistry.
Good. So I come from Mumbai. I come from a family where my father is a dentist. Mother was a homemaker, brought us up. And my father is a periodontist. He graduated from GDC Mumbai. So growing up, of course, I did not visit the clinic much, but I did know what he was up to in terms of dentistry. So once I passed 10th standard, I was really inclined towards computers. Believe it or not, I was really thinking that I would end up becoming a computer engineer, but maths got in the way. So I just hated maths and then realized that computers is not something that I could do without maths. So I said, okay, let me try the biology field. So went into biology and then applied to a few dental schools and got into CODS in Davanagere in Karnataka. So I did my dentistry there for 5 years. Great life, hostel life. Still miss those days of college life. And once I finished dentistry, of course, came at a crossroads as to join private practice with Dad, or if I should do something else and specialize. And that's when Dad said, nothing doing. You're not coming back here until you specialize and gain more experience. So that taught me thinking, and I applied to various dental schools in the US and got into a program called the Advanced Education in General Dentistry. So this is a one-year program where you do everything on one chair, so that the patient comes into you like a private practice, and you get to hone your skills for 1 year. And kind of molds you into a good general dentist. So I did that, and then I said, okay, I still need to specialize something, and I was really interested in prostho at that point of time. This was at Boston University in Boston, US. And at that time I said, you know what, let me see if prostho is something that I really want to do. So after the regular day at AGD, when I used to finish the day and go back to my room, we used to leave the school at around 7, 8 after doing all the lab work and stuff. And I used to see the prostho PGs come in at that time. And I used to talk to them, and they're like, oh yeah, we're going to start work now and probably end at 3 in the morning or 4 in the morning. And I said, okay, this is not something that I can do. I need my sleep. I said, I'm interested in surgery. Oral surgery in the US is 6 years. So I said, I'm not going to spend 6 years doing it. So let me think about perio. And having a periodontist at home, I said, let me think about perio. So I applied to perio at a few schools. Got into a state school, the University of North Carolina at Chapel Hill. Turns out now it's one of the top 5 schools in the world. Had a great 3-year residency there. Got exposed to all the things that a periodontist and an implantologist needs to know. Got my hands rough doing a lot of cases. And once that got over, I got married to my wife, Aparna, who is also a periodontist. So now there are 3 periodontists in the family, and which is why we are called the PerioFamily. So Aparna came into my life, and I joined as a professor in Nova Southeastern University in Florida. Taught there perio and implants, and then we moved to East Carolina University, where I was the director of the implant program there. And then finally I said, both of us decided that we need to head back to our country and be close to our parents and give our son the joy of living close to his grandparents. So that's what we did, and we came back in 2017, and since then I've been in practice in Mumbai. And it's been going good. We've been enjoying our life back there, a good balance of work and life. So it's been good.
So you have studied both in India and in the US. What differences did you notice?
So one of the major differences that I feel is the camaraderie that we have with our faculty is something that is unique. In the US, during the day, again, they are your professors, they teach you stuff. As soon as the clock strikes 5, they are like your colleagues. They will come have a beer with you, and it's that kind of interaction is amazing. So I think that is one major difference that I find between education here and there, where at the end of the day, we are all colleagues. I mean, we are there to learn, and we are there to have fun. So I think that is one aspect that needs to change. Also in India, I think there needs to be more emphasis on practical knowledge, because we are all doing, most of us at least, doing post-graduations in clinical specialties. So there's only that much theory that is needed when you actually practice in a clinic. But the emphasis on theory is a lot more and less on the practical aspect. So I hope that changes in the near future here as well.
So do you have any advice for those who want to get into perio or implantology?
Yeah, I think one of the main advices that I can give is to find a mentor, find someone who can guide you. If you do have a local periodontist who you would know, who is into clinical practice, who is doing a lot of implants, just go and observe him and see if that is what you would like to do for the rest of your life. So I think finding a mentor, finding someone to shadow is very important. And for those of you who are still in college, I think one of the major things that you should do is hang out in that department, in the department that interests you. Go and talk to the professors and tell them that I'm interested in this subject. Would you mind if I observe a few surgeries, if I assist in a few surgeries? And that's how you kind of evoke your interest and ensure that you really do like the subject before you step into doing it.